Hello, welcome to Anatomy DAHAR series. I am Dr. Abdul Hamid. Today's topic is oropharynx and laryngopharynx. Free medical education, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. The pharynx. Pharynx in Latin means throat. It is a funnel-shaped fibromuscular tube, that is fibrous tissue and muscle tissue forming a tube, which is located in the head and the upper part of the neck. Anterior wall of the pharynx has deficiencies, communicates with nasal cavity at posterior nasal opening called choana, oral cavity at oropharyngeal isthmus, and laryngeal cavity at the inlet of the larynx. Parts of the pharynx. On account of these three communications, therefore, the pharynx is divided into three parts. The part behind the nose, the nasopharynx, also called epipharynx. The part behind the mouth, called oropharynx, and the part behind the opening of the larynx, called laryngopharynx, also known as hypopharynx. Therefore, oropharynx is the second part of the pharynx. It is located behind the oral cavity and anterior to the cervical vertebrae, prevertebral muscles, and prevertebral fascia. Oropharynx. Let's see the diagram first. This is the hard palate. This is the soft palate. This is anterior arch of the atlas, that is at the level of first cervical vertebra. This is second cervical vertebra, and this is the third cervical vertebra. This is the tongue. Behind the tongue is the epiglottis. This is upper border of the epiglottis is at the level of halfway of the third cervical vertebra. Let's talk about the extent of the oropharynx. Oropharynx extends from the lower surface of the soft palate above, that is at the level of anterior arch of the atlas, first cervical vertebra, and inferiorly it is at the level of the upper border of the epiglottis, which is halfway down the third cervical vertebra. Relations of the oropharynx. Superiorly, that is above, it is connected with the nasopharynx through the nasopharyngeal isthmus. Superiorly, it is connected to the nasopharynx through the nasopharyngeal isthmus. Posteriorly, it is related to the posterior walls of three constrictor muscles. They are superior, middle, and inferior constrictor muscles, upper three cervical vertebrae, prevertebral muscles, and prevertebral fascia. Inferiorly, it is connected with the laryngopharynx at the upper border of the epiglottis. This is the one, this is the larynx, so this is the laryngopharyngeal junction here, which is at the level of the upper border of the epiglottis. Anterior relations of the oropharynx. Let's see the diagram first. We are in the oropharynx, looking anterior, where we have the oral cavity is here. So the roof of the oral cavity is, you can see the soft palate here. On the lateral side of the oral cavity, we have two arches. The anterior one is called palatoglossal arch, made up of palatoglossal muscles. Posterior arch is palatopharyngeal arch, made up of palatopharyngeal muscles. Here, this is the dorsal part of the tongue. This is posterior 1/3 of the tongue. This is epiglottis. This is upper border of the epiglottis. Anterior relations of the oropharynx. Oropharynx anterior relations can be divided into two parts. The upper part, looking directly into the oral cavity, and the lower part, looking the structures below. Now the upper part, we are looking from behind into the oral cavity through the oral pharyngeal isthmus. It is bounded laterally on each side by palatoclossal fold made up of the muscle of the same name. So they form the boundary between the oral cavity and oropharynx. That means boundary between the oral cavity and oropharynx is the anterior arch here, the pillar here, that is the palatoclossal folds is the boundary between the oral cavity and oropharynx. Now the lower part, anterior relations, you can see here, this is the dorsal surface of posterior 1/3 of the tongue, which consists of lingual tonsils, upper free end of epiglottis behind the tongue, one median and two lateral dorso-epiglottic fold, that is in anterior surface of the epiglottic. There are three folds are there. We call dorso-epiglottic fold, one median and one each on the lateral side, connecting the anterior surface of the epiglottic to the dorsum of the tongue. Between these three dorso-epiglottic fold, we have a epiglottic vallecula. That is, you can see here, a shallow fossa. Each is between the median and lateral epiglottic folds in front of the epiglottic. In this diagram, we cannot see that vallecula. Longitudinal muscles, they are inner group of pharyngeal muscles. We have two diagrams here. This is lateral wall looking from inside, medial view. This is lateral wall looking from outside, lateral view. Okay, let's see the structures here. This is auditory tube. This is soft palate. And this is the pharyngeal region. In this diagram, here is the soft palate. And here is the styloid process. This is the pharyngeal region. So, inner groups of muscles, three longitudinal pharyngeal muscles are, number one, palatopharyngeus, coming from the soft palate to the pharynx, coming from the soft palate to the pharynx. Number two, stylopharyngeus, coming from the styloid process to the pharynx. And the third one is salpingopharyngeus, coming from the auditory tube to the pharynx. There are three inner groups of muscle, longitudinal pharyngeal muscles. Lateral wall of the oropharynx. Let's see the diagram first. We are looking the inner surface of the right wall of the oral cavity and oropharynx. This is the hard palate. This is the soft palate. This is the dorsum of the tongue. From the soft palate, we have two muscles coming down. You can see here, this is palatopharyngeus muscles going backwards. This is palatoclossal muscles going forward and attached to the side of the tongue. Let's see lateral wall of the oropharynx again. So we have a pair of vertical ridges or pillars on each wall of the oropharynx, extend downwards from the side of the palate. Coming downwards from the side of the palate, they descend and diverged. They are A, that is palatopharyngeal arch, downwards and backwards to the pharyngeal wall, and B, palatoglossal arch, downwards and forwards to the lateral margin of the tongue. They form this one is palatoglossal arch, forms the boundary between the oral cavity and oral pharynx. This is the boundary between the oral cavity and the oral pharynx. These arches are formed by the respective muscles. This posterior arch is formed by the palatopharyngeal muscle. This one is formed by the palatoglossal muscle, respectively. On each side of the wall here, between the two arches, we have a triangular shaped cavity is there, fossa is there, called tonsillar fossa, C, where palatine tonsil is located. Tonsillar fossa represents the second pharyngeal pouch embryologically. Laryngopharynx. Let's see the diagram first. You can see here, this is the epiglottis, upper border of the epiglottis. If you come down, you can see this is cricoid cartilage. This is the lamina of the cricoid cartilage. This is the lower border of the cricoid cartilage, which is at the level of lower border of the sixth cervical vertebra. Now let's talk about the laryngopharynx. Laryngopharynx is the third and the lowest part of the pharynx. Because of that, it is also known as hypopharynx. Laryngopharynx extends from A, that is the upper border of the epiglottis. This is the epiglottis. It extends from the upper border of the epiglottis to the level of B, that is lower border of the cricoid cartilage anteriorly, and which is at the level of lower border of the sixth cervical vertebra posteriorly. So anteriorly, lower border of the cricoid cartilage, posteriorly, lower border of the sixth cervical vertebra. At this level, it is continuous with the esophagus. So junction between the laryngopharynx and the esophagus is the narrowest part of the gastrointestinal tract, except the opening of the appendix. Anterior relations of the laryngopharynx. Let's see the diagram first. This is the laryngeal inlet. Actually, this area is the laryngopharynx. Anteriorly, here is the inlet into the larynx. This is epiglottis. This is lateral wall of the inlet, aryepiglottic fold. This is posterior wall of the inlet, interarytenoid fold is here. So this is the inlet into the larynx. Let's talk about the anterior relation of the laryngopharynx. Anterior wall, the upper part, we have the opening into the larynx. This is the laryngeal inlet, that is anterior wall at the upper part. Below this inlet, clinically we call hypopharynx. This is the hypopharynx is here. The laryngeal inlet is bounded by above by epiglottis, laterally by aryepiglottic fold, and posteriorly by interarytenoid folds. Anterior wall comprises arytenoideus and the lamina of the cricoid cartilage. Okay, we cannot see this thing here. We'll see only the boundaries of the laryngeal inlet. Here is anteriorly epiglottis, laterally is aryepiglottic fold and posteriorly is interarytenoid folds surrounding the laryngeal inlet. Lateral on each side and below the laryngeal inlet, each side and below the laryngeal inlet is a shallow fossa, piriform, that is pear-shaped recess called piriform recess. It is broad above and narrow below. Cancer at this fossa usually without early symptoms. It also is a danger site for perforation by endoscope. Posterior wall of the laryngopharynx. Let's see the diagram first. This is right lateral view of the pharyngeal muscles. This is superior constrictor. This is middle constrictor. These two are inferior constrictor. The upper part is thyropharyngeal part of the inferior constrictor, arises from the thyroid cartilage. This is cricopharyngeal part of the inferior constrictor, arises from the cricoid cartilage. Posterior part of the cricoid cartilage, we have a lamina will be there. At the upper border of the lamina, at the level is the vocal cord. Now let's talk about the posterior wall of the laryngopharynx. Posterior wall of the laryngopharynx is formed by posterior wall of the superior, middle and thyropharyngeal part of the inferior constrictor. That is superior, middle and thyropharyngeal part of the inferior constrictor. They overlapped. They descend down to the level of vocal fold, which is at the level of upper border of the cricoid lamina. So these three muscles will come down up to this level. Below that is, behind is, we are having your cricoid lamina. There's only cricopharyngeal part of the inferior constrictor muscle this here, below this one. Junction between the thyropharyngeal part of the inferior constrictor and cricopharyngeal part of the inferior constrictor is the site of dehiscence of Killian between these two parts of the inferior constrictor. Please see Anatomy DAHAR series pharyngeal muscles to further study about the dehiscence of Killians. The end. Illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Free medical education. Thank you.